Are you experiencing back pain that's been classified as an SI joint or sacroiliac dysfunction? Are you getting adjustments once, if not twice to 2 to 3 times a week with minimal to no improvement? Or are you giving reset exercises to help with your pelvic torsion that's leading you nowhere? Hey, my name is Dr. Antonio Gurule. I'm a chiropractor here in Boulder, Colorado with Enhanced Movements Chiropractic, Boulder County's premier chiropractic injury and pain consultant. We help people with low back pain. We help people create a better story so that they don't have to live with back pain for the rest of their lives. And one of those issues that we commonly get, not only in questions from emails or messengers, but also in our office, is they come in with the diagnosis already of SI joint pain, or my SI is flared up, or I feel like my pelvis is torqued. And this has been essentially just imprinted and changed in their own mindset as to this is what I have and I will always have, and I need someone to fix it when it goes out or it changes. And this is really kind of a more or less like a diagnosis because they don't know what the hell's going on, or it's just a simple diagnosis because many professions, that's what's told to be the most common source of back pain. So if someone comes in with back pain, you just label them as SI joint dysfunction because you need to be able to adjust, you need to be able to justify the treatments that you're giving or the only treatments that you know how to do for low back pain. But there's a little bit more involved. If we look at the way the structure of the SI joint works, which again is the sacroiliac, so we're talking about the sacrum, I have a pelvis here I'm going to show you, and the ilium, it is the keystone structure and joint structures that connect our upper body to our lower body. While there is some articular motion that happens with certain movements, it is limited and few and far between. Might be more for some and it might be less for others, but understanding the mechanics of how this actually works, there is little movement that happens. Now, certain populations, such as pregnancy and relaxin, you're going to see a little bit more of that. You're going to see more movement within those joints because it has to open up for childbirth, right? So this is not a blanket statement in saying that this is how it happens all the time. And that's what we're trying to dispel, is this is not how it happens all the time. Maybe there's something else going on. So the routine care that you're always getting or the putting it back in place what's actually happening might not be what you actually think it is. So if we look at this structure here, right, here's your pelvis. Okay, we got our hip bones here, nice, good, greasy ball and socket joint. Here's your sacrum. Sacrum is attached at the bottom of the spine here. Okay, lumbar spine, which is your low back, sacrum, and then here's your SI joint. So sacroiliac joint right here. Okay, now it's a nice flat joint, so you get a little bit of this. Because of the angle of the sacrum, you can see here, there's kind of like an oblique angle here. So what you see is when you're walking, because of our legs going forward and backwards, you get a little bit of this, which means that pelvic structure is like this. You're going to see a little bit of this, the pubic bone. You see a little bit of rotation here, minimal, very, very small, as that kind of rocks. But most of that offset is going to happen from the spine and the shoulders swinging around. So this does not move all that much in normal day activities in life. Now, certain positions might put more stress on it, but as we already said, structurally, this is what connects the upper body to the lower body. It's super strong. You have this network of ligaments and fascia and connective tissue, not only in the front side, but also the back side, along with muscular structures and muscle groups that go across, not only from the spine, but also across with the glutes, some coming from the sacrum over to the pelvis, some coming from the sacrum over to the leg. There is a whole network system that's responsible for keeping this area together and strong. Now, whereas, just like we have still ligaments and muscles supporting it, we see the lower back and just the spine in general, it should and has the ability to move side to side, front and back, as well as rotation. So when you're dealing with someone that's exhibiting some lower back pain, I would argue that it's probably more or less coming from a lumbar structure or issue or problem rather than your SI joint. Which the conversation and the question needs to be had, because if you're just treating SI joint pain, you're missing the whole point of what's actually happening with the lumbar spine. And more importantly, it's not just a passive, adjust it, deal with my torsion, put it back into place type of scenario, right? You need to understand painful provocation movements. How did it happen in the first place if there was an event? And or what are the repetitive patterns in which we think might have generated the pain issue in the first place, right? What are you consistently doing that's going to cause your pelvis to be torqued or out of place? And not only that, if it did get torqued, why doesn't it untorque? What are you doing in your day-to-day that's creating so much tension that your pelvis is torqued and now it's stuck there, that you can't get it out and you need someone else to put it back in? Okay? Or are there repetitive movements or repetitive motions or things that you're consistently doing on a day-to-day basis that's maybe overloading the lower back and it just feels tight because it's not getting enough movement? Or the things that you're doing, you're not leveraging big ball and socket joints appropriately to use the big glutes, and thus you feel a little bit more tension in the lower back because you're not lifting appropriately. To say low back pain is simply just a joint issue or an SI joint issue at that is limited, and you're going to be missing things. And or you're putting in to the patient's mind, or you have been told this, that it's an SI joint issue and that you just need to come back and get it put back into place. What if that wasn't the case and you were taught what to do when you do have a little bit of flare-up, right? What if it was just a simple get down on the floor, stretch or exercise, or a little squat activation, or something that allows you to just lay down, decompress, and breathe, and that takes care of the issue? Okay, so we're just wanting to have a conversation around what the SI joint is first and foremost, how it operates, and the likelihood of it actually being the driving force for the pain that you're experiencing. Now, could you have SI joint dysfunction? 100%. We're not saying that that is not at all a possibility, but is it as prevalent as we see? I don't think so. Because we're testing it. We're challenging through orthopedic evaluation, assessments, and tests, is the SI joint actually symptomatic and influencing the discomfort or pain that you're having? Okay, but you got to go to a provider that does it. If you go to a provider that simply just puts you on the table and adjusts you without asking any questions or actually stressing or putting your body into positions or movements, they have no idea. They're throwing darts at the wall hoping to hit a target. You're better off when dealing with your pain from not only a monetary standpoint, but from a time investment standpoint, to actually get the right diagnosis through a proper assessment and evaluation so that the structure and the plan lines up with what you have. If you get put into a template, or if you just get put into this cogwheel of a system, you're going to waste more time, more money, and you're probably going to have a recurrent episode in which you have to then invest all over again. So if you've been told you have SI joint dysfunction, or if you're being treated for SI joint pain, I would encourage you to ask these questions to your provider. Ask them more as to why they think this is the issue. Ask them what you can do on your own to help facilitate the process. Ask them, how do I deal with this and not have this type of discomfort again? They should have answers to all those questions if their evaluation and their conclusion they're confident in. If they don't have it, then you know you're going to run into an issue down the road. If you don't have that, Google, find someone else. If you don't have the information in which to know how to screen another provider, you can reach out to us. Okay? We're more than happy to help this. Again, our mission is to help people with lower back pain so they can create a better story for themselves, to not live under the burden and fear of lower back pain, to live the life that they want. Okay, I really appreciate you guys digging in and listening to this. We're going to come up with some more videos about lower back pain so that you have a better understanding about how the back operates, how the relationships between all of these systems work in order for you to feel better, to move better, to be stronger, and to be mobile so that you can, again, live that story and live that life. Once again, I'm Dr. Antonio, Enhanced Movements Chiropractic here in Boulder, Colorado. Please feel free to reach out to us. Share this with a friend. If you know someone who is dealing with this and needs a little bit of help, do them a favor and share this information with them. We'll see you guys next time.